Platelet-rich plasma, also known as PRP, is enjoying a spike in patient interest. Today, I want to review the process that we use for preparing our PRP and show some of our patient data. After an initial patient consultation, emphasizing the experimental nature of this treatment and the fact that side effects might include swelling or tenderness to the scalp, we talk about what areas the patient is interested in treating. We use a PRP separating tube known as a ACell PRP tube. The whole blood is inserted into these tubes and placed in a centrifuge for 5 minutes. This typically yields about 1 to 3 cc's of platelet-rich plasma and 4 to 5 cc's of platelet-poor plasma. While injecting, it is important to continue to agitate the PRP ACell slurry, otherwise a small plug of ACell particles can form. This whole process usually produces a total of 10 to 18 cc's of PRP ACell, which we then inject 2 to 4 millimeters below the surface, hopefully at the level of the bulge. We do, however, numb our patients before injecting with 5 to 10 cc's of 1 or 2% lidocaine with a 1 in 200,000 epinephrine in a ring block. This whole process usually takes about an hour, and many patients return to work afterwards or simply go about their day, since there are very few restrictions with regard to activities or eating, medications, etc. If we are injecting PRP alone, we typically inject at a 1-month interval. If we are using the PRP ACell, we inject at 3-month intervals. Both of these treatments need to be continued for at least 6 months before a patient can expect to see any effect, even if a hair check device or cross-sectional trichometer picks up an improvement before then. In our practice, we track the progress of our patients using a hair check device, and it does a better job than photos can because it essentially is measuring the wood in your forest, not just the number of trees. Here are the charts of several of our patients' results over several treatments of 3 months apart, and you can see how the areas we inject, namely the front and the top, seem to have some additional growth, while the areas we do not inject, specifically the back of the head at the donor area, do not change much at all with the treatment. In my experience, the PRP or the PRP and ACell treatments do not replace the standby medications of finasteride and minoxidil, but they can be useful, especially in patients who cannot take these medications, or as an adjunct for those patients who want to do as much as they possibly can.